a big thumbs up and leave a comment down below. Thank you. Hi, I am Dr. Tinglestorm and today I'll be your chiropractor. So, of course, my hands are fully clean and sanitized, but for your comfort, I'll be popping on a pair of brand new gloves. Okay? Would you mind telling me what is the issue? So, is a pain just located into the lower back, or is it expanding? I see. Okay, so do you have any recent x-rays or MRIs that I can look maybe? You don't? Okay, by your description I suspect that could be a bulging disc, okay? So let me just see a little bit how your mobility goes and how much it is affected by this pain, and then we can proceed with a very targeted adjustment, okay? Alright, so I'm gonna start by having a look at your neck. Is that okay if I place my hands just underneath your jaws? Okay, I'm gonna ask you to look up for me. Good. And now you look down. Good. You come back to center. Nice job. Now I'm gonna ask you to look to the left. Okay. And to the right. Okay. And again, come back to center. Good. So how did that feel? Was that painful? I could hear a little bit of crinkle crackles indeed. Yeah. Alright. So now I'm gonna check at your thoracic spine. So I am asking you to place one arm on top of the opposite shoulder, yes. And let's try to do some gentle twists here. How is it feeling? Uncomfortable? Yeah, I can see that your mobility is indeed quite limited. Let's see on the other side, okay? So we're gonna bend, alright, like that. And again, let's twist the thoracic spine. Of course, I'm not forcing any movement, okay? My hands are just placed onto the area of interest to see your range of movement and how everything coordinates. Okay, yeah, there is even more blockage on this side. As you said that the pain is actually more acute on this part, yeah? Okay, so now I'm gonna have a look at the hip. So can you lift your little leg up without bending the knee, okay? I'm placing my hand here onto your hip. Alright. Up until the end of your range of movement. Is that it? Okay, good. No. You don't have to be super bendy. I just need to know how you're feeling right now, where you're at with your body, okay? So the level is here. Do you have a blockage maybe in the back of your glute, in the upper back, or is it a blockage in regards of the hamstring? Okay, so it's more still related to the lumbar spine. I see. Okay, can we just see if you can wiggle upright? Good. And the discomfort, would you mind if I tap some areas in the legs so you can tell me up up until where you feel the discomfort. Here, here, here. So it goes quite a long way. Good. Let me just have a look at the knee as well. Have you had any knee injuries? That's usually also something related. Okay. Your patella kind of crackles a little bit. Yeah, when we tend to protect a part of our body that is injured or in pain, everything else kind of follows. Okay, the knee, the ankle and the toes have a nice range of movement. Do you perceive any discomfort here? It can indeed have some repercussions onto this part as well. Yes, absolutely. Let's have a look at the other side. Okay, so I am once again just following along. You lead the movement up without bending the knee. Alright, good. Is this your max ever? Not saying that you're trying hard enough, it's just to understand when you make it to the end of your range. Okay, good. Let's give it a nice wiggle here. It does feel a little more loose. Let me have a look at the knee. Okay, does that hurt? Has this knee ever given you any particular problem? Okay, I understand. Alright. And the heel. I see. Okay. So if I asked you to stand up and bend forward, would that be painful for you? Yes. Do you think it's something you could do, or? Okay, that's okay. That's not a problem. That's a very important indicator. How about having you laying on your belly for a second? Okay, good. Once again, I want to test your motion here. So I am gently trying to lift your upper back. Just like that. How is it feeling? Okay, you do feel pressure here. I do even feel there is some tight knots here. I want to see how much you can lift this leg. Okay, and how about the other? Wait for me, wait. Not that fast, I'm running around you. Okay, let's go. Yeah, there is definitely some limited mobility here. Can you just swing your arm forward? Okay. Is that painful? Let's have a look at the other arm now. Moving forward. Alright, so yeah, you have a little more mobility towards the right side because it's not affected particularly or as much as the left side, I would say. But we have to undergo some very hardcore targeted adjustments today, and I promise it's absolutely something that we can fix. It's just that it will take some hard work. Are you ready for that? Okay, let's get started. Come back onto your back. Are you comfortable? I want you to know that I will never hurt you or force anything. Everything I do is a mechanical adjustment. You will hear hear some dramatic cracks. They feel even more dramatic inside of your head. But this will not cause any injury to your body, okay? You are in safe hands. And I also want to address you to a massage practitioner after this session in order for the benefits to last even longer, and that will be Dr. Mabel, which is an amazing professional. But now let's just get started with the adjustment, okay? So I am starting from the head. Yeah, I'm coming up close. Alright, like that. So, are you ready? We are moving with your breathing, so you lead the pace. Alright? Okay, you take a deep inhale in from the nose. Okay, now you exhale. Good. How did that feel? Was that painful? No, right? Let's do this one more time, shall we? A deep inhale and you exhale. Perfect. How is it going? Alright, let me come right behind you. Is everything okay? Alright, you take a deep inhale. Good. Let's do this one more time. A deep inhale. Perfect. How does it feel? I know that the neck adjustment usually sound very dramatic, but it's all good. Alright, now I'm moving towards your shoulder. I need you to take a deep inhale for me. Good. And now you exhale. Awesome. I am moving your arms like this, and you once again take a deep inhale for me, and you exhale. Good. Let's go back to the other side of the body. So I am moving all around you, 360 degrees. Yeah. Alright, so let's take a deep inhale, deep in from the nose, and then you exhale. Good. Put in the arm like that. Still working on the shoulder. Deep inhale, and you exhale. Awesome. Okay. I just noticed a little imbalance in the jaw, so deep inhale for me, and you exhale. Awesome. Let's do this one more time. Deep inhale, and you exhale. Perfect. Let me work on this elbow. I need you to take a deep inhale for me, and you exhale. Very good. And now this elbow, deep inhale for me. You exhale. Perfect. Let's start focusing onto the hips now. Okay, so I'm grabbing your leg like that. I'm gonna need you to take a deep inhale for me. Good, and you exhale. Perfect. Opening to the side. One more deep inhale. You exhale. Fantastic. Now we are going for a nice twist, or what we call a spinal twist. You take a deep inhale and you exhale. Perfect. Good job. How is this feeling? liberating. Yeah. You see that you already have more range of movement here. That's great. Let's move on with the other hip. So I'm right here. I'm gonna grab it. Yeah. Bend the knee slightly. I'm gonna need you to take a deep inhale for me. And you exhale. Good. Let's open to the side. You take a deep inhale for me. And you exhale. You take a deep inhale for me. And you exhale. And now let's go for one more spinal twist on this side. You take a deep inhale. And you exhale. Perfect. Awesome job. Let's have a look at your heels. So I need a big inhale. Okay. Now this one. Another big inhale for me. And you exhale. Good. Alright. Now I'm gonna have you twisting onto one side, okay? Alright. Let's go. So the bottom arm grabs around your rib cage and the other arm grabs the bottom arm. Good. Now we bend this leg and we take a deep inhale and then we exhale right here. I am coming here, working on the T-spine. You take a deep inhale and you exhale. Perfect. How does that feel? Very good. Let's move on to the other side. Bottom arm grabs the rib cage. Top arm grabs the bottom arm. We bend one leg on top of the other. And now we have a little twist. And you take a deep inhale and you exhale. Good. Let's do this one more time. You take a deep inhale, then you exhale. Perfect. Take a deep inhale, then you exhale. You take another deep inhale and you exhale. Nice. Now I'm working on the thoracic spine. You maintain this twist right here. I need you to take a deep inhale, then you exhale. Perfect. I am placing one hand underneath your rib cage. I need you to take a deep inhale, then you exhale. Perfect. Alright. Now you can be on your belly. How does it feel? Good. Alright, now I'm going to need you to place one hand on top of the other and both hands are underneath your chin. I'm coming behind you and I'm going to pull you, okay? Alright, take a deep inhale and you exhale. Let's do this one more time. Deep inhale, then you exhale. Perfect. Let's just switch the crossing. I'm coming here. Good. So you switch the hands, you take a deep inhale and you exhale. Wonderful. Let's do this again. A deep inhale and then you exhale. Perfect. Now I'm gonna do something similar but with the lower part of your body. So I am crossing one leg on top of the other like this. I am gonna lift you. Yes, that was my hip. Alright, I need you to take a deep inhale. Exhale. Nice. Let's try again. Okay, deep inhale. You exhale. Perfect. Let me undo the crossing. You're definitely gonna enjoy Miss Maple's massage after this adjustment. It's gonna help you relax. It's gonna help your joints regenerate. And you just deserve it. Okay, deep inhale for me. And you exhale. Alright. One more. Deep inhale for me. You exhale. Perfect. Good job. How is it feeling? I can already tell that you are much more loose now. Okay. Just try to be relaxed. Deep inhale and you exhale. Deep inhale, then you exhale. Good. Like that. I'm just working here now. I need you to take a deep inhale. You exhale. Perfect. Deep inhale. Exhale. Good. Alright. Take a deep inhale for me. You exhale. Alright. Awesome. Let's repeat this on the other side now. All good. Alright, so you take a deep inhale for me and you exhale. Nice. Deep inhale for me. You exhale. Good. Let's just stand here. Deep inhale. You exhale. Perfect. Deep inhale for me and exhale. Right. Deep inhale, then you exhale. Okay, very good. How is it feeling? Is everything okay? Just one last adjustment at your neck. So you take a deep inhale, and you exhale. And you take another deep inhale, then you exhale. Alright. The adjustment is now completed. As I said, for you to fully benefit of the intense work we did today, I would recommend you undergo one of Maple's amazing massages. So if you don't mind, let me just give her a phone call so we can see if she's ready to receive you right now, okay? Hold on a quick second. Hi, Dr. Maple. It's Stormie. Yes, I have a patient here who just did a very intense adjustment. It was a full body adjustment, but mostly related to some lower back pain. And I thought it would be great if you could give them one of your amazing massages. Is there any chance you have a slot now, maybe? Fantastic, I'll send them right over. Thank you so much. Bye. Great news. Maple is free right now, so you can find her office right at the end of the hallway, and she's gonna be right there waiting for you. I've already informed her with everything, and I'll even send her a quick recap email in the meantime. Nothing to worry about, okay? Alright, thank you so much for your time and attention, and I'll talk to you soon. Bye!
Hello, I'm Dr. Maple. Are you all comfortable and ready for your massage? Okay, perfect. Well, I was going over Dr. Tinglestorm's notes while you were getting ready. It seems like you've had quite a few intensive adjustments today, haven't you? Yeah. So I think what we'll do is do a bit of targeted deep tissue massage, but then we'll end the session with a nice soothing and gentle massage. That way it'll help your muscles relax from all the excitement they've been through today. And then that way the chiro adjustments you have had will sit in a lot easier, and the recovery time will be a lot smoother for you. But I'm going to begin just by assessing how everything is with my own hands, seeing where we'll have to really do some deep tissue. Yeah, so just relax as much as possible. Okay, so did have quite a few adjustments to your shoulders. They are feeling very, very even. Dr. Tinglestorm always does amazing work, so I'm not surprised. Have you been experiencing any stiffness or even any pain since your adjustments earlier? Less pain than before your adjustments? That's a very good sign. Just a little bit of stiffness. No worries. We can look into that. Okay, let's check your spine. Yeah, I can definitely feel that there's been quite a few adjustments in here. Everything seems to be sitting really nicely right now, though, so that's a good sign. Okay. And then your lower back was the area of most of your adjustments today. Is there any area here where you are still experiencing pain? Yeah, okay. And how would you rate that on a scale of 1 to 10, just right here? Okay. And earlier today it would have been... Okay, that's really good. Yeah, I can definitely feel a little bit of overcompensation from the muscles, but nowadays with sitting in computer chairs for a lot of the day, it's become pretty standard in my line of work. But good news for you, it seems to be that we've made some really good work today. So let's see if we can make that even better for you. I'm going to be going along with my gua sha stick and just, like I said, doing some targeted deep tissue. What happens sometimes when we have some chiro adjustments is the muscles can become quite tense because everything's suddenly in a new location. And like I said, the muscle then tries to overcompensate. So by having a massage after, it helps relax these muscles. It helps them become adjusted to the adjustments. Okay, you might feel a little bit of pressure in the part where you had pain, so let me know if you want less pressure. Is that good? A little bit more even? Okay. You're a brave soldier. Okay, let's let that settle for now. Now there were a couple places in your spine I want to work through. I'm very, very happy with how everything seems right now. It may take a couple of days, waking up a little bit sore and stiff, but after that you should feel a lot better. Couple of places just in your shoulder blades. Again, let me know if the pressure is ever too much. Let's just see how everything's sitting now. Okay, yeah. I think you're going to be very happy with the results here. Might just go over the lower back a couple more places. You did do quite a few adjustments here, so it's perfectly normal that the muscles are going to be a little bit more resistant. Okay, one more. Okay, perfect. Well, like I said, since you have been through quite a lot today, let's just finish with a nice soothing massage. Almost like a little cool down for your muscles that have been working so hard, especially today. If you want to close your eyes during this section, you're more than welcome to. In fact, quite a few people find this so relaxing they end up falling asleep. So if you want to, you can go ahead. There's no one booked in this room for the rest of the day, so I can just come and get you when it's time to pack up the office. There we go, starting to relax the muscles. Good, good, good. Okay. We're pretty much all done here. I hope that you enjoyed your adjustments as well as your massage. Hopefully you're feeling nice and rejuvenated. And I also want to thank Dr. Tinglestorm for her excellent work as always. I'm always so impressed by what she does. Thank you so much for joining us today. Hope to see you again soon. Bye.